Hello, Pranav Da, everyone. Thank you for this opportunity of presenting to you. This work was undertaken by myself and Dr. Fiona Brennan, who's a consultant anaesthetist at UHW and is a main figure for sustainability across Wales and further afield. So just some background to myself. I'm an operating department practitioner working in the theatre department for Cwmtaf Maghanog University Health Board from 2009. I'm the lead of the anaesthetic team, which consists of anaesthetically trained nurses and ODPs, and I've been in this role since 2018. I'm keen on quality improvement projects and strategic long-term thinking, which lends itself quite well to sustainability. I've been involved with the Welsh Anaesthetic Green Network since its inception as WEAN, and I've led several projects informally and formally, ranging from streamlining pharmaceutical drugs, clinical waste segregation, recycling and repurposing into furniture and equipment for the department, advocating for reusable equipment, and creating a partnership with the University of South Wales to repurpose out-of-date equipment, which has diverted 95% of our consumables from incineration, saving thousands for the UHB, and in the first 6 months over about £20,000 for USW, whilst providing high fidelity training for students. So the medical gases decarbonisation secondment started around September 2024. And I will be presenting to you the work that has or is ongoing in respect to the medical gases decarbonisation. So the first thing that was required within this comment was to write this policy. It's a policy for sustainable procurement, management, administration and disposal of medical gases in the hospital setting, and as you can see, it's aligned to the NHS Wales decarbonisation strategic delivery plan and approach to healthcare initiatives 40 and 41. So why the focus on nitrous oxide? Reduction on all gases is important. We have to reduce our emissions for everything, but nitrous oxide is in particularly bad pollutant, so it's targeted as a big win. As you can see, its global warming potential is 273 times that of carbon dioxide, and previous work which we've done on removing desfluorine, which was 2,540 global warming potential, was really successful. And I just want to put the point in that some people are not aware of. So the really most frustrating aspect of all this is that how inefficient nitrous oxide, or should I say piped nitrous oxide, is. Numerous studies have shown that it's in excess of over 90% across England, Wales, Scotland. The lowest I've seen in studies is 83% wasted before it reaches the patient. So what does the policy recommend? So the first recommendation, as you can see, is consider the carbon footprint in addition to the clinical and economical value. And a lot of this is targeted to the anaesthetist. If you can use an alternative to inhalation agent, do it. And be aware that the Royal College of Anaesthetists have supported the decommissioning of nitrous oxide manifolds, and have said new hospital builds should not have a pipe supply. For other gases such as sevoflurane, which has a global warming potential of 144, alternative anaesthetics such as Tiva can be utilised where volatile inhalation gas is not required, and an induction drug such as like propofol is put through an infusion, which is far better for the environment. Recommendation 2, medical gases committee must have a standing item to monitor usage levels on the medical gases dashboard. This recommendation is just pushing, monitoring, ongoing and auditing our usage. The medical gases dashboard was created on back of the fluorines dashboard, which will be pivotal in auditing and highlighting high usage areas to target decommissioning of manifolds and transitioning to a portable cylinder option. And recommendation 3, short and simple, there seems to be a lack of standardization where purchasing originated from. By including this recommendation, we're seeking to standardize across Wales, and we think the dashboard will help with the centralized procurement issue. So some of the examples of the actions that can be taken are just noted on this slide and the next slide. So you've got the work with the Welsh Government Value and Sustainability Board to promote the spread and scale of work already started on nitrous oxide and extrapolate this to Entonox and other medical gases. Also work with modelling the costs, so this will enable clinicians and health boards to decide what is appropriate and where there could be cost savings, to just give a bit more incentive to why we should be doing this, and also work within the AWTTC to develop on the current dashboard, which I will go on to later. And second, through gathering the information of this body of work, tracking cylinders is quite difficult. Often the cylinders are being rented but are not accounted for. And as you see from the third one, the all sites authorised persons should carry out a system loss test within 6 months of receiving this document. As previously discussed, it's usually over 90% wastage. Entonox is around 60%, the studies have shown so far. So again, hugely inefficient. So just wanted to give you a timeline of progress. So Dr. Lisa Hancock, consultant anaesthetist as part of the Welsh Anesthetic Network, started writing this policy, I believe, the end of 2023 into 2024. Her secondment finished, and then mine started in September 2024, and with Dr. Fiona Brennan started a month or so later. So the policy summary was submitted to AWTTC on the 31st of October. The policy itself was written and submitted on the 25th of November, reviewed and presented at OPAG on 11th December, consultation period January, February, OPAG 12th of March, and then very recently it was presented and successfully endorsed at the All Wales Medicine Strategy Group on the 20th of May. So I just wanted to give a quick shout out, so big help, thank you from Richard Baldero and Sean Harbon during this process, and also Tom Curran, who also supported in the absence of Richard for the OPAG meeting. So thank you very much for all, really appreciate all your help. So now some examples of actions in progress. Exploring new technology advancements such as the Viola eBreathe and SageTech. So the Entonox eBreathe projects undertaken by UHW, led by Dr. Charlotte Oliver. They've secured funding from Welsh Government to have an All Wales pilot to this. So they're just going through that now with finance and with each health board trying to think about how they're going to get the maintenance costs and how they're actually going to roll this out. But everything seems really positive with that. As you can see, in terms of the decommissioning of the manifolds, Cardiff and Vale have one remaining, so they've done really well. Naira Bevan have decommissioned 3 out of their 4 manifolds. Betsy Cadwaladr has decommissioned 1, and Cwmtaf have got a grant to decommission and terminate fully as well. Some of the other examples of actions in progress, so if you can use Penthrox instead of Entonox for adults in A&E, that's much better for the environment. So that's something which started analysing and trying to promote where possible. And also finally the medical gases dashboard, which has been set up. So I'll briefly go through that now in a bit more detail. So Stephen Griffiths mainly created this live dashboard. Obviously this is just some screenshots just for demonstration purposes. But it allows a breakdown of usage via health board on a month by month basis, and you can drill down as well to include, exclude the health board or certain months. So just really give you some really good data to help drive that change and highlight the problem areas. Another example is that you can just create run charts for month by month to identify peaks and try to figure out why a particular piece, like for example in this one, January 2021, why is there been so much usage? Why then? So it could be expiry, could be with COVID during that time, but it's just a good picture to just say, oh, why have we got a big spike, or how can we get that down? And then another breakdown that can be viewed is the expired cylinders. Again, this can be viewed on a particular month. It can also include, exclude the health boards, and as you can see from this image, it just easily demonstrates targets, areas where you can reduce waste. and improve things. So ultimately, expired cylinders, you should really not have any, because they're expired, so you shouldn't be using them, can't be using them. So you're paying for nothing, paying for a product you can't use. So just from this particular, you can see 2 health boards there straight away. You can reduce that easily. And this is a particular report on the data should promote good management of stock and aid lean service delivery. And further to this, there are more tabs that can be seen on the medical gas boards, and there are a possibility of automatically generating reports monthly, quarterly, and they could potentially be sent to health boards to prompt investigation and just drive this change. So ultimately, this dashboard is going to be fantastic. It's a real game changer, I feel. So I've just provided some links. So I just mentioned about the USW and CUMTAF projects, so I thought I'd add in this. Just some information of the background. So, I am speaking some truth, and there's evidence about this topic. I've linked in the Decarbonation Strategic Delivery Plan, and that bottom one is the dashboards. If you wanted to have a look, you probably will need to log in. But it's really interesting. So it's good font of knowledge there. And thank you very much for your time. If you'd like a copy of this presentation, please let me know. I can send it to you. Equally, I can be contacted on craig.hawley@wales.nhs.uk. Thank you. Diolch.